One of the challenges of medicine is coming up with an accurate diagnosis. Well, science is a big help, and they have new diagnostic technology. To learn more, joining us is Sue Bell Smith from Penrad Imaging.
Hi, Carol.
Hi, Sue. Oh, what is Penrad?
Penrad Imaging is actually a freestanding radiology organization. It's not a hospital, so that's where people get confused sometimes. We are actually 40 to 60% less than any outpatient hospital radiology department. Our radiologists are all local, and we've been here since 1978.
Wow. So you've seen a lot of changes in the technology.
The changes in technology are just incredible, just in the 20 years I've been with the company. It's amazing what we can do now, the types of pictures we can see, the types of diagnoses we can make. It's just, as far as patient care goes, there have just been incredible changes, and there's more to come every day.
Well, what about your heart screening? I hear a lot about that. That's within the last few years, right?
It is. The Penrad heart screen is actually a CT scan. It only takes about 10 seconds for the actual scan, so it's a very low dose of radiation. And this test detects the calcified plaque in the coronary arteries of your heart. So this is a great screening exam. Anybody can order their own if they're over 38 years old. They don't have any abnormal symptoms. But this is a great exam that provides a calculation of what your risk is for heart attack or heart disease. So we see a lot of patients that are possibly unwilling to go see a regular physician, but they will come and have a screening exam. So the results of those exams often then lead those patients back to their physicians to say, I have an increased risk. Now what do I need to do? I need to change the way I eat. I need to start exercising. So now they pay attention but they feel a little less intimidated because it is an exam they can order themselves.
Is it a good benchmark too?
It's an excellent benchmark, particularly if you've had heart disease in your family. If you are predisposed in any way, it's a great benchmark to have, and it's a great tool, and it's a very inexpensive tool.
Good. That's very interesting. Extremely valuable.
Yes.
Well, what about radiation? What are the X-rays and all that? How has all that changed?
Well, and radiation, you have to remember, you don't get radiation in all exams.
Okay.
Ultrasound doesn't use radiation.
Okay.
MRI doesn't use radiation. And nowadays, with science that you mentioned before and advanced technology, we actually have software that automates the dose reduction, the radiation dose reduction. So in other words, you get radiation based on the exam you're having done, your age, your weight, and it automatically calculates the least amount of radiation required to obtain the best possible images, because after all, the diagnosis is the most important part of that.
That's true.
But using the least amount of radiation is also very important, particularly in pediatric patients. They get a much smaller dose of radiation on certain exams than adults do. So it is very important to us, and it's very important to the public. You don't want to be over-radiated by having unnecessary x-rays of any kind. So you want to always make sure you know where your previous studies are, and that whoever's looking at your current images is always looking at your previous images also.
And that's true with bone density too.
Yes, it is.
Okay, to have the same people look at it so that...
Yes, you always want to have comparison studies. So if you're going for imaging or radiology exams, number one, you want to go to a facility that has accredited equipment, and you want to be scanned by a technologist that's also certified. Those are very important, and they're always... Facilities like ours, we're always going to ask you where your previous studies were, so our radiologists can compare and actually look at any changes that have occurred throughout the years.
All right, so there's a lot out there to help the patient know better where they are.
Absolutely.
And Penrad Imaging is one place to consider.
It definitely is.
Because there's a lot offered there.
Yes, there is.
Thank you, Sue.
Thank you, Carol.